Tonight, doctors in Kansas are seeing the largest documented outbreak of tuberculosis in the United States. It's an illness that we've all heard about over the years, but how does it spread, and does our community have anything to worry about? LBK's Maddie Powers got some answers for us tonight. Maddie?
It's Microbacterium tuberculosis.
Is commonly referred to as TB. Now, it's very uncommon in the U.S., and the city of Lubbock averages around 4 active cases per year. While it's something that we don't really see here in the States today, the health department says when a case is found here, they'll make sure everyone that person knows or has been in contact with is aware.
It's Microbacterium tuberculosis is its longer name.
But usually, people call tuberculosis by its nickname, TB. It's not a common disease we see here in the U.S., but that's not the case for the rest of the world.
It's mostly common in third world countries. A lot of countries in Asia, and Africa is still very common.
This disease is a bacterial infection that mainly affects the lungs and is spread through airborne droplets. There are 2 sides to TB that are very different from one another.
One is active TB. They can be symptomatic, and the symptoms can vary. It can be minor symptoms like cough, whereas in more severe form you can see people getting really sick, they're coughing out blood, losing weight. Whereas in the other form, it's called latent TB, where patient get infected where the bacteria remains dormant inside the human body, so they does not get sick.
TB is very contagious, but really spreads when large groups of people are gathered for a long period of time.
Homeless shelters, prisons. Right, so if somebody has a tuberculosis and is not identified early enough, and then he continues to have symptoms, continues to stay in that congregate setting, then he will continue to spread to other people.
For patients with tuberculosis, treatment involves antibiotics and can take months. And even though it's pretty uncommon, the health department still takes it very seriously.
If we know that there's a case, an active case, we do figure out who that network is. If that person was working somewhere, we would let that workplace know, and we would test those contacts of that individual.
Maddie Powers, KLBK News.